Massive formula shortage has us asking the questions about how can we keep this from happening ever again? And why are we even in this situation? We are digging in deep for you with our exclusive Economy Brain Room series. We're going to focus on topics that matter to you with solution-based reporting. I am joined right now by economist Dr. Ernst Coupe and pediatrician Payal Adhikari. Thank you, both of you, for being here. So first, Dr. Coupe, the FDA is predicting that shelves will actually be fuller. They're going to have more formula available sometime this summer, maybe as early as July. But should parents expect the prices of that formula to be relatively high because of what we've been going through across the country?
Absolutely. Prices will remain high as long as there's a shortage. So shortages provide high prices. And unfortunately for parents, that's what's going to exist for some time.
Yeah, I don't think anybody's going to say, oh, I won't buy it.
Yeah, absolutely.
They're going to look for their coupons, but they're not going to not buy the formula. Was this, obviously, there's a lot of people who are trying to DIY their formula right now, Dr. Adhikari. It's like they're going to Tijuana to buy it, or they're coming up with some old school recipe that they found from the 1950s for formula. But what are the risks involved with doing that?
So bottom line is it's not safe to make your own formula. There are so many risks involved. The FDA has very specific guidelines on how formula should be produced because babies are not adults. Their bodies are very immature. Their kidneys are immature, and they can't process things the way that we can. So there's very specific ingredients in formula, and the risks are malnutrition, poor growth, poor development, and then you get on to the really scary things like seizure and death if things are not made properly.
And what about traveling to Mexico? Because we've been seeing that reporting.
I would not.
You would not?
Yeah, I would only, we only want people to have FDA-approved formula.
So what are the options?
So the options are, parents really need to understand that they don't have to be brand loyal. So they can switch between formulas. The same way grown-ups can switch between types of milk, brands of milk, what's on sale. We kind of just pick and choose what we get. The same thing applies for formula. Of course, that does not apply for kids who have very specific medical needs, right? Kids who have cow's milk protein allergies or even more significant allergies. But for your typical healthy child, you can switch between not only brands of formula, but types of formula. So if you can find something else that's on the shelves, that's a very reasonable option to have.
Keep your fingers crossed that they'll keep it down, because some babies can be kind of picky. And I want to say Dr. Coupe, that's correct, right?
Ernst is fine.
Ernst is fine, okay. Is this just this perfect storm of supply chain issues, manufacturer issues, and then this unprecedented time in history that we've been in over the past couple of years? Is that what led to this?
It is a perfect storm, but more so it's because of the structure of the industry. When you have 4 suppliers providing a product for the entire market, any hiccup with one of the manufacturers, any regulatory problems,
like happened with Abbott,
absolutely, will produce this type of outcome. Inflation has a lot to do with it, of course, but in terms of not being able to get the product itself, forgetting the price, that's going to be caused with 4 manufacturers, that's going to happen.
So we need more manufacturers, is what I hear you saying.
Yes, and we have laws for that. It's not necessarily to reduce the number of, or let's say increase the number of manufacturers to, let's say, an infinite amount, but their law, Sherman Act antitrust law, is there for these types of issues where you have 4 suppliers in the market. Any type of hiccup in that particular market will produce such an outcome. So it would behoove our country to move away from that. More so when you have 4 manufacturers, the supply of that product is shrunk, as well as the prices increase. So it would help all families if we can find ways to encourage more suppliers to enter the market.
I have one more question for you, Dr. Adhikari, and we only have like 20 seconds to answer it, so you can kind of give me your yes or no. But some are asking about whether or not they should allow another woman's breast milk to be the source of food if they can't find the formula that they need.
Sure, absolutely.
And
if
there's
it's
nothing
a trusted
wrong with
person,
that.
Absolutely.
That's a healthy option.
If you know that woman is healthy and her labs have been normal, then yes.
Okay. Dr. Adhikari, Dr. Coupe, Ernst, thank you so much for being here. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.